Welcome from northern Poland, from Gdansk. Marek Bukowski, I would like to tell you a story that is very private and personal because it's based on my family story. I will tell you how we combine medicine, the story, the object, and the museum in one, in my opinion, complete story. I am the fourth generation of doctors in my family. It started more than 140 years ago with my great-grandfather. Here are my grandmother and grandfather. They were both doctors, and you can see my grandfather is sitting on a very fancy canvas, and the photo was taken in Siberia when my grandparents were sent by communists. During the Second World War, they luckily returned Poland after the war and find my father. He's here. He stayed during the war alone in Poland. Here's my father and my mother, and here is Agnieszka, my wife, and I. And on this story, on this picture, there are only my part of family because Agnieszka's parents, her brother, his wife, and daughter are also doctors. It means that from the very young age I was filled with a number of medical stories. In the beginning, that were a private, personal experience of my parents, their friends, and there were fairy tales, some jokes, and in time, when I start studying medicine, I have to combine the concrete, solid medical knowledge, information with all this information of these stories that I was given by my family. Uh, when I start to think about this presentation, I just drive an abstract and then think how to tell you the story, how to reveal all this of my conclusions and remarks that I've done for 30 years teaching students. I suddenly realized that one of the most important part of this medical world is the fact that the medical language turned to be more and more complicated. So very student and the young doctors, of course patient, are dazed and confused because of terminology. So sometimes the primary aim of doctor is to explain the terms, explain the medical issues, and then to set and using the normal everyday language. And I start to think that our museum objects can be very useful to explain this complicated words. This explanation, in my opinion, is illustrated by these two photos. On the left side, we have a small object surrounded by other items, and it is very hard and difficult to notice the details of this black person. On the right, the person is clear from the surroundings, other things, and we are able to see details, the structure. So presenting object in the museum by observing, touching, smelling, sniffing is to let the audience not only to touch, to see, but also to understand the issue of this object. And return to my personal history. My great grandfather bag, closed and open. The bag is about 140 years old, and the old bag today contains the very modern items that were unknown for my great grandfather, and it is how we can use the object to illustrate the development and improvement of the medicine. I also often ask my audience, my visitors, about the antibiotics. Have you ever used antibiotics? Majority of audience did it. So I said, please imagine that 100 years ago, in May 1925, we are not able to use the antibiotic drugs, so our group will be perhaps smaller because some of the people, some of us will be died because of some kind of inflammatory disease. So when we take a look at the calendar of the 20th century, we can notice how many things, how many important news were introduced to the medicine in the last 100 years. The last one, the face transplant. When I started studying medicine, the face transplant was something from the science fiction. It was much more from Frankenstein than from Star Wars or Star Trek. Today, it is a normal clinical practice. So everything changed, and we have to show our audience, our students, all these changes that are happened today. 100 years ago, there was no antibiotics. Introducing penicillin, streptomycin, and other antibiotic drugs changed the face of medicine, changed the face of civilization completely. And we are not able to predict what will happen without these factors. The next very important story is the story of surgical gloves. Today we don't even use the term surgical, we use medical gloves. In the middle of the 19th century, Ignaz Semmelweis struggled against the sepsis, and he pushed and forced people to wash the hand. And it was something brilliant and something new, but medical world denied it. Later, Joseph Lister started clear antiseptic surgery. But the side effect of this clear surgery was a problem with eczema and inflammatory changes of the allergic changes of the hands of surgeons and nurses. William Halsted solved the problem with the company Goodyear. They started to produce the surgical gloves. In the end of 19th century, they started to be sterilized. Later, to let the surgeons easier put hands inside the gloves, they were filled with chalk. Year by year, we collect information and conclusion, and it was found out that the chalk is not good. So because of producing postoperative scarring and inflammation and the skin change in surgeons. So from the end of 2016, the powder gloves were banned. So we start to produce new non-allergic gloves made of latex-free materials, polyvinyl, neoprene, and other. And we are not able to imagine what will happen in the future. But the gloves in our collections are important to. After years of experience and collecting information, we have modern gloves. They are made of latex, they are powder free. We use them at the hospital every single day, and we also use them at our museum to tell the story about the improvement in surgery. Surgical gloves are the object that are background to present the dream about clear and secure surgery and love that made Dr. Halsted to take care of this favorite nurse skin. So it's very important to choose the perfect object that can be the base of our story. The story that should be like a script for the Oscar awarded movie. And finally, I would like to point it out that sometimes we have to take a look at the human's emotion that made us to move, to make a step ahead. Sometimes emotions are positive, like in this case, because the care, the love made the progress. Sometimes they are awful, like hate or vanity. But as usually we separate science from emotion, in the normal life it's impossible. So we have to combine them. And in my opinion, in made student and audience, our visitors at the museum understand the story, the history much more easier. It is also easier for them to treat this past as a traditional heritage, as a part of their professional or personal identity. That is what teaching with object is about, in my opinion. Some small talk about using object in revealing the history of medicine, but some conclusion. We can't treat the history of the medicine as a chronological list of development and improvement of medicine. Dates become significant, but they were related to the universal history, especially history of science and industrial revolution. Museum objects can help and sometimes are only platform for explaining complicated theories and terms in the field of medicine. Before using in the museum, before using in teaching, each object must be very carefully developed, described, from the technical details to its official and whispered story. Also, what is important for me, it's my very personal conclusion. Sometimes we need some inspiration, and here are 4 titles for important books. The Thomas Kuhn, The Structure of Scientific Revolution, Richard Feynman, sure you are joking, Mr. Feynman, Oliver Sacks, On the Move, Thomas Goetz, The Remedy, Robert Koch, Arthur Conan Doyle, and The Quest to Cure Tuberculosis, and other important books about the history of science, about the history of industrial revolution, about the medicine, and also about the philosophy of medicine. My personal story is the story given by my 3 generation of my ancestors, and I'm very thankful to them because without them I would be nowhere. Thank you and bye.